Hello and welcome. My name is Lindsay Campoy, and I'm the Membership and Professional Development Associate for the Association of California. We are about to begin session number 10, titled OT Practice, Demonstrating Resilience in the Face of Disruption, featuring Evelyn Anderson, Carrie Thompson, Hillary Valentine, Robert Hobbs, Paula Cook, and Brenda Lyman. Before we start the session, we'd like to go over some quick housekeeping reminders. All participants are automatically muted upon entry into the session. Only the presenters and the room monitor will have speaking privileges during the session webinar. We will be utilizing the question and answer feature during the webinar to facilitate any questions that you may have at the conclusion of the pre-recorded or live session. The Q&A feature is located at the bottom of your Zoom webinar screen. The presenters will be live to answer questions during the final 15 minutes or so of the presentation. This webinar broadcast is being recorded in its entirety, including the Q&A at the end, and you can access that recording in Socio within the next week. You will have access to it for 60 days following the event unless indicated otherwise by the presenters. Lastly, and most importantly, following the session, there will be a link for the session evaluation in the chat window. Complete this evaluation in order to receive your certificate of completion. You will receive an email from FlexiQuiz that will contain your certificate once you complete the eval. If you miss it in the chat window, a link to the evaluation will be added to the session description section for this presentation in the Socio platform. If you should have any questions during the session or after the conclusion of symposium, you can contact the Western Regional OT Spring Symposium office and OTAC staff using the email addresses shown below. We would also like to take a brief moment to acknowledge and thank our sponsors for this event. Without further ado, we'll now begin the session. Thank you for your attendance and enjoy.
Hi, this is Chuck Willmarth. I'm the Vice President of Health Policy and State Affairs with the American Occupational Therapy Association. I am delighted to be working with a panel of state presidents talking about how they've been able to demonstrate resilience in the face of disruption in light of the COVID-19. We're going to start off with some introductions, and I'm going to call on each of our panelists, and I'll go first. Again, I'm with the American Occupational Therapy Association, and I distinctly remember the beginning of the pandemic. It was on my birthday, and it was something else. I was going to go out to dinner. Everything was canceled, and so it's been a very stressful time period for everyone. And the theme of this session is related to resilience. Just a couple of things. I think at the beginning of the pandemic, there was a period where we felt helpless. Just a little thing for me, I get up each day and decided I was going to make my bed. It's one thing I can control, and so that's something that's been helpful to me. My family here, we've been quarantined essentially at the house since last March. My wife works from home, and then of course my two children that are 10 and 13 have been in virtual school ever since. And so one of the things that we did was we adopted a kitten. And so it's been very nice to have a new addition to the family. So with that, let's move on to Evelyn from Arizona.
Yes. Hi, good morning, everyone. So I'm Evelyn Anderson, and I'm the president for the Arizona OT Association. And yes, it certainly has been a strange year personally. And so last year was my first year as a state president, and I've never held a president position before. So I'm sure, same as for you all, it was an interesting year to be a state president. So of course, as everybody else, I was a little bit stunned at first, but we had an emergency board meeting and we just went from there. And I just have to thank everybody on the Arizona board and our committee members, especially the legislative committee, because I could not have made it leading this association without them. We have really strong, knowledgeable people there. And professionally, I had just started a new position with Huntington University. I've been in education for a long time, so I left my previous employer and I started with Huntington on February 24th, right before the pandemic hit. And I was to start a new OTD program. So in one way, it was actually pretty good timing for me because I did not have to think about how to convert to teaching virtually or anything. I didn't have any students. My job was to prepare the AOTA candidacy report, and I could do that just as well from home, although it was a little bit strange. And just the thing about setting your day when there are no there's no start and end of it, and just scheduling yourself and getting breaks in and not work all the time was a challenge for me, big challenge. But here in Arizona, we actually were in lockdown for the first 3 months, but in June, we were back to work again. So my university has essentially been open, even though my program has not had any students. So I, in one way, have not been as isolated as many other people have been. But of course, personal challenges, learning to use technology much more than before. That's been a challenge for me, and learning to do all these Zooms, and we've had town hall meetings with Arizona. So that's been some adjustments for me.
Great. Thanks, Evelyn. Carrie from Idaho.
Yes. Yeah, like everyone, we definitely had our challenges. For myself, I know I have a private practice, and it was definitely a challenge. I think the biggest thing for me is I'm definitely a go with the flow type of personality, and I'm always positive, and thank goodness, because even though it was the worst of times for a lot of the time, especially those first couple of months, I think it helped to be that type of person that always kind of looks like things are going to happen for a reason. There's going to be positives that come out of it. I tried to stay positive also, just because not only did I have our members of our association looking up to me to be calm and to help figure it out and navigate the system, but I also had that for my whole private practice. I felt like, again, the calmer I am, the more positive I am. Okay, we're going to look for solutions. We're going to figure this out. We got to work together. It helped things go more smoothly. And I really think that's kind of what helped us through it. There's definitely been those ups and downs throughout it. Having, multiple staff having to quarantine at different times. Even though our whole practice kind of shut down, we were all telehealth. So half of us were at home while the other half were saying, I can't work from home. My whole family is working from home. I have no place to work. So we would set up individual treatment rooms where the therapists just were kind of in their own rooms at their own times. So lots of, I would say, just constantly problem solving. This whole last year has just been that opportunity, I guess, to really work through and create solutions. So overall, I think even though it's been a challenge, there's a lot of positives that have come out of it too.
Great. Thanks, Carrie. And Robert with the New Mexico Occupational Therapy Association.
Hi, yeah, I'm gonna have to just kind of go along with what the first two speakers said. It was a smack upside the head, I gotta tell you. It was quite a shock. I'm also a business owner. I have a couple of agencies, and so besides just being with the New Mexico OT Association, I had a lot happening and coming in at once with my agency. I work with adults with developmental disabilities. I own a couple of day programs and employment services there. And then I also contract with a lot of the school districts around New Mexico in another agency. So as you can imagine, going into the schools as a school therapist and then suddenly being told you can't was a challenge in and of itself. Just a lot of therapists had actually never even used Zoom before, believe it or not, or Google Meets or Google Classroom. So that was all new. It was a big challenge. And so there was quite a learning curve there. But I think the biggest challenge for us, you know, obviously with the telehealth and, you know, kind of advocating for reimbursement from different payers and all that kind of stuff was going on, and really helping explain to some of these payers and some of our legislators, you know, what our value is, even online, was a scramble, was tough. But beyond that, getting into the schools where the school districts were supplying kids with Chromebooks and things like that, they did a great job. New Mexico is a very, very rural district. Well, most of us West states are, or district state. Most of us states in the West are very rural. And out, especially on some of the Indian pueblos and reservations, there's really no internet, there's no broadband. And some of these kids are sitting at home. And, you know, a lot of the kids that we serve on the reservations we just didn't see them or hear from them. You tried to make phone calls and half the time that wouldn't work. So that was a big challenge, but we were somehow able to overcome those, and we got some broadband out there, and then we're able to get into local, whether it was a chapter house or a school, to do some things a couple days a week, of course, with all the distancing and stuff. So that all worked. It was just a lot of advocating and really helping support that. We lost our annual conference. We just did not have the technical wherewithal to rebound so quickly. We had to cancel that. That was in August, because we looked at ourselves and said, we can't do this. But I have a couple committees, a membership and a CEU committee that really stepped up. And there was a long-standing idea that we kind of jokingly called brews and CEUs. We thought we'd do CEU things in a bar. You know, we have a lot of local breweries here, and that idea kind of took off, and we replaced at least the CEU portion or aspect of our conference with that. We had weekly sessions and had a lot of volunteers come in, and we had online sessions. I did one, my vice president did one. A lot of people really stepped up and joined, and people were able to get our therapists were able to get their annual allotment of CEUs for that. I think a lot of people were really afraid of, you know, without the conference there, what they were going to do, but that seemed to work out pretty well.
Great.
That's
Thanks,
it.
Robert.
Mhm.
And now we'll go to Paula with the Nevada OT Association.
Thanks, Chuck. Hi, everyone. I'm Paula from Nevada, and I live in Las Vegas. I work in an acute hospital with pediatrics, and if you had told me last March that we would still be in pandemic mode at the end of February 2021, I probably would not have believed you, but here we are. And it has, I would say, personally, I'm in my office now on Zoom. This is probably the 5th office I've tried. We've been playing musical offices in my household with 2 kids at home doing distance learning since last March. So that's been kind of fun, and I do feel like we finally figured out what works for us. So now that we're scheduled to go back. You know, a lot of the therapists in our state are very similar to me, have elementary to high school age children at home. We're trying to figure out how to manage distance learning, childcare, partners who are also at home all the time, and while also going to work. And then how do we, just the mental load of, you know, are we exposing our families to what we're seeing at work? And so that's been a challenge for sure, for everybody. But, you know, personally, and, you know, my colleagues and I, we've been trying to, you know, find our occupations. I started painting more, playing more soccer in our backyard, doing bullet journals. We've been doing that fake commute where we actually ride our bikes to school every day and then ride right back home and log on to the computer. So that's kind of where we're at now, and I'm looking forward to speaking more about what we've done as a state. So thanks.
Great. Thanks, Paula. Brian from California.
Yeah, hi, thanks, Chuck. My name is Bryant Edwards. I'm the president of the OT Association of California. First off, I love that, Paula, you guys were riding your bikes to school and back. I think that's awesome. Yeah, you know, I actually feel really fortunate. I work in a hospital setting as well, primarily in administration, so I don't have the patient care contact, but we were really fortunate. I think our infection prevention team saw the writing on the wall in January and put a lot of practices into place in terms of PPE conservation and own screening practices. So my work setting has actually been fairly safe and ahead of the curve. We got testing up and going, and so it felt like a safe place to go into and sort of dig in there. So I had less disruption in terms of my own work, but we did, of course, had to convert to telehealth and things like that at work. In terms of the association, I'm also super, super grateful for the leaders within OTAC, because we were able to just sort of lean on one another, commiserate, vent, experience together, and hold each other up, which has been a huge benefit. And then I think just in terms of my own personal resilience, again, we saw the writing on the wall sort of early. Invested early in a Nintendo Switch, and I got to relive my childhood days. And so we've been binging on Zelda and Super Mario Brothers. And it's been a nice way to sort of come back and admittedly just sort of zone out in a fun way, but also in a way that helps me recharge at least. So.
Great. Thanks, Bryant.
Yeah.
Brenda from Utah.
Hi, I'm Brenda Lyman, and I'm the president of the Utah OT Association. My background is in pediatrics. I've had about almost 40 years of clinical experience as an occupational therapist, and almost 20 years as a tenured professor, and the last 6 years I've been in the role of associate dean, and I oversee programs that are in mortuary science, radiologic technology, physical therapist assistant, and occupational therapy assistant. And we've had so many changes in the academic realm. Of course, we've had to go to the virtual courses. We call them internet broadcast courses, synchronous as well as the asynchronous online courses. The changes that have happened in the workplace are incredible. The faculty have just had to put in so much time and effort to change over their face-to-face classes, and just at the last minute, those that were able to have face-to-face classes for our labs, we have to do check-ins. Students are standing in the hall, of course, physical distancing, and having to get their temperature checked and go through a series of questions before they can even walk in the classroom. And then in the classroom, having to physical distance as much as possible, and go through all that protocol, which for me, it's required more lab sessions, because some of our rooms don't accommodate the class sizes if we're having to do physical distancing. So it's been a real interesting ordeal over the last year, trying to change up and improve every term as we move forward. It's from a personal note, I have had an opportunity to telework, which I quite honestly have really enjoyed. And this is the first time in 30 years since I built my house and I've lived here that my playground, and I have a playground on the whole, I'm a pediatric clinician, and I've got a huge playground on the east side of my house that look towards the mountains. And it's the first time it's ever been weed-free in 20 years. And the reason for that is because every time I'm working and then all at once I need to take a break, boom, I go out there and pull some weeds, or something's frustrating, I pull some weeds, and there's not a weed in my playground and it looks great. So anyway, this whole time has really helped my my property to look a little bit better. As far as the UOTA goes, we were having virtual business meetings before COVID hit. So that was nice to have had that started and to continue. So we continue that. On a note of telehealth, where I work, I wrote a grant, it was probably about 5 years ago now, to develop telehealth. And so we've been training the students to do telehealth. So it's been really fun watching our members in our organization be able to come back to us and say, hey, we're teaching everybody at our place how to do Zoom and how to, and all that with telehealth. So that's been a real positive for us. But everyone has just been absolutely fantastic on the board of the OTA and our members. And so I really appreciate all their energy and their support and adaptation getting through this time.
Great. Thanks, Brenda. For this next segment, we're going to discuss how the COVID-19 pandemic impacted the profession and how state associations responded to the challenge through resilience. And to kick it off, I want the panel members to go back in time about a year ago, late February, early March 2020, and think about the initial response to COVID. Everything shut down pretty much at once. Restaurants were closed, governors were ordering people to stay home, only essential business. Nobody had masks. I mean, it was quite a difficult time. From the AOTA perspective, we pulled together in different departments at AOTA and had actually a daily meeting where we discussed what we had heard, but also tried to figure out, how members were being impacted and what those members' needs were. And so from the outset of the pandemic, we really focused on getting information out to members. Basic information about PPE, basic information about, at the state level, the different orders that had come out. At the federal level, obviously the state of emergency and those sort of things. In addition to that initial information, we put out some decision guides to help people in different practice areas about how to approach things. We pulled together FAQs. At the policy level, of course, we were very much focused on pressing CMS to allow for telehealth, particularly in Medicare Part B, but in other settings. And at the state level, and this, I think we'll get into this, there were some initial challenges with telehealth not being recognized by Medicaid. And then we had a handful of states where the licensing board had not allowed telehealth. So if we could, think back to March of 2020, as the COVID pandemic was playing out and everything was being shut down, and clinics were being closed. There was just a tremendous impact early on. So think back to what happened, but also how did the state association respond? What kind of resources did you develop for your members? So is there anybody in particular that would like to address that, or I can call on somebody? All right. So Carrie in Idaho, March 2020, what happened?
Yes. Well, thankfully for us, we were actually very not lucky, but honestly, Idaho was one of the last states to truly get hit. We saw it happening around, we were hearing about it on the news. I have still quite a few friends back in California that are OT practitioners. So I'd be on the phone with them or they were texting me. And when I started hearing things were closing there and all of a sudden the stuff that was happening, it became more real than just seeing it on the news. So I felt like I was really proactive and really all of a sudden saying, this is probably going to be here within a few days or a week. And I immediately started going through all of the provider handbooks for Medicaid. Well, first I went to our rules to make sure, can we do telehealth? Is it in there? And I was pretty sure it was, because we had just, worked on that a couple years ago. But then going through every provider handbook and, checking with every insurance company, what do they allow? What don't they allow? And not only kind of going through that, and it was the follow-up phone calls to every single one. And I was probably on the phone almost between 3 and 5 days straight, I feel, of trying to figure out what they're going to cover, what they're not going to cover, and are they going to lift these restrictions, and then trying to advocate, saying, but you have to, and these are the reasons why, and sending them the research. And it was almost like one thing after the other. Like as soon as we would peel off one layer of that onion, there was something else that would pop up, like, what, you don't cover CODAs for this? And then we'd have to go back and get CODAs to be covered. And then we'd find out they weren't going to cover certain codes. And so we'd have to go back and we'd have to fight for all of general OT codes, like 97530 wasn't going to be covered. Or, it was just almost one thing after the other. But we just, again, kept going at it. And the other issue was Blue Cross of Idaho, which is probably our largest insurance company in Idaho, wasn't going to allow any platform except their own. And so that would basically take all telehealth away from all of our patients, because most of them have that as their primary. And so we again had to advocate to allow them to allow the practitioners to use any platform besides their platform, because it would take a month to 2 months to enroll and get on their platform.
Oh,
So those were some of our biggest challenges, I would say, right away. But because I feel like we were a little bit ahead of it actually happening here, we were able to resolve issues pretty quickly in time. And then we quickly, also had a town hall meeting and a board meeting within that first week before, again, I felt like it even really hit here. So I felt like we were in a good place pretty quickly. So
great. Thanks, Carrie. Evelyn, I recall in Arizona, there was a challenge there. I believe the licensure law wasn't clear in terms of telehealth. Can you talk about some of the advocacy efforts that the Arizona Association engaged in, and any other initial activities as COVID happened?
Yes, exactly. So we were not prepared at all. I felt like it had hit us from one day to the other. Everything closed down, and we were sitting at home emailing each other in the Arizona board. Well, we need to have an emergency meeting here. And the issue was, like Chuck said, that we, in our licensure, we did not have authority to provide telehealth. And our licensure board went out immediately and posted that on their website. And of course, that was a big stir among all our members, emailing us, what should we do? We're not allowed to provide telehealth. What's going on here? So it was quite agitated discussions, emails going back and forth. And it got a little bit heated between the licensure board members and our OT practitioners at one point. And luckily, we have a very gifted OT practitioner who also has a law degree. And so she was the one who was able to establish a really good communication going between the chair of our licensure board and our lobbyist and the governor's office, so that we had one channel of communication, so to speak, so that we could coordinate this effort and lobbying the governor's office and pushing for this emergency telehealth bill to be signed. And I can't quite remember those days. It wasn't very long, but I do have a date that he actually signed the emergency bill on March 25th. And I remember it was in the evening. And I did almost not sleep there for those 2 days, because we were constantly on emails back and forth of what's going on. Oh, they're pushing it, they're looking at it. He's going to sign it, he's going to sign it. He's signing it now. So it was quite dramatic there. I've never experienced anything like it. So yeah, so that was a learning experience. But again, I was so amazed that we all pulled together. And the good thing that came out of this was that we actually established a really good collaboration with our licensure board. And they have, after this, called on us for our expertise and input as we, in the continuing effort to make the telehealth bill permanent. So that was nice. We established a good communication link there. And of course, as soon as the emergency bill was signed, now we had to help our practitioners with ideas and help them with understanding regulations, documentation, how to provide telehealth. So we had a town hall in April, early April, and we organized it so that members could send in questions ahead of time. And then had presentations from our board members and legislative members who were experts in certain areas, and then practitioners could ask us questions, and we recorded it and we continued the discussion after the town hall. So we felt that that was very helpful for our members.
That's great. Thanks. Bryant, in California, I recall that there were some initial advocacy efforts that OTAC engaged in development of resources. Can you talk about California's initial response?
Yeah, sure. I think similar to what we've heard a lot, we as a board had to quickly pivot to virtual meetings, which probably sounds like, okay, what's the big deal in that? But it allowed us to continue our operations, right? It allowed us to continue to make decisions on behalf of the membership and be responsive to their needs. And I know early on, one of the big sticking points for us was many of our testing sites for the NBCOT exam got shut down. And so students were graduating, but they weren't able to sit for the exam. And we do have in California the ability for new or just graduated students not past the NBCOT to have a limited permit, but it's limited. And so we worked with our board as well, and to advocate there to extend that time frame. And so that's been successful, and it actually got renewed again, because even though some of the testing sites have opened up, they're at limited capacity. So we're still seeing some of that bottleneck for students in being able to get timely appointments for their exams. I think similar to what we heard from some of the other states, we got a lot of questions related to telehealth. Fortunately, it was in our practice act, so we were able to do it, but it went from being something that I think was more of a niche practice to being thrust into the mainstream. And so we quickly tried to push out resources to folks. We put things available on our website. We have probably, I don't know, a half dozen or so webinars and professional development sessions that are recorded on our website for people to access in terms of best practice or things like that. We put information that AOTA put out or CMS put out related to telehealth toolkits, things like that. Another big area that we got a lot of inquiry around was related to infection prevention and PPE. And I think people, especially those working in home health, were wondering, like, what are our rights? What should we expect at a minimum as somebody going into other people's homes? And so we tried to link to a lot of information, both from CDC, the World Health Organization, but also from our own state Department of Consumer Affairs and our Board of OT in terms of language, so that we could inform and empower people to go back to their employers and say, look, this is what I need, or to really equip them with those tools. And then since then, we've pivoted almost entirely virtual. We had a virtual conference in October. Obviously, this conference is virtual. We've had monthly town hall webinars, which are a combination of information and updates, legislative updates, advocacy updates, but then also professional development sessions ranging from racial justice and occupational justice to telehealth and school-based practice. Most recently, one of the big things that we've heard from students is they're panicked. They're really stressed about going out into the workforce, not having as much clinical experience as maybe their previous colleagues. And so we've been trying to figure out what we can do there. And so we launched a Day in the Life series where we have current practitioners come in and just talk about what it's like to be in practice. So we've done that a couple times for students, and it's been well attended. And then most recently, what we've done is we put a lot of information related to the vaccine. That's, of course, on everybody's mind. So putting information in terms of just general education on what the vaccine is, linking to other resources in different languages so that people can take that to their clients. And we had a practitioner here who wrote a great position paper on OT's role in vaccine, and really through the OT practice framework and looking at how to assist our clients in terms of accessing the vaccine. So I think we've really tried to be responsive to the moment. And like Carrie said, like, just adapt and be flexible and really try to meet our members' needs.
Great, thanks, Brian. Well, speaking of adapting, let's delve into that a little bit more in this next segment. Thinking back to May, June, and July of last year, it was clear that the pandemic was going to be here for a while. I sort of remember at the outset, the announcement from the schools, we're going to shut down schools for 2 weeks and then we'll be back. Well, it didn't happen that way. When it became clear that this was going to be a long-term situation, and I think at that point we were peaking in terms of the number of cases, and of course, sadly, the deaths were going up. At the AOTA level, we really focused in on providing more resources. Of course, we had canceled the AOTA conference in Boston in April, and so we had a tremendous amount of content that we wanted to get out related to conference. And at the same time, there was a need to get information out in response to COVID-19. So we did two things. One was we moved that conference content to a series of webinars that people could sign up for and take. So we reached out to all of our presenters to see if they wanted to make that transition. Then we scheduled everything. And then on a parallel track, we created what we called the COVID-19 series. And so that was a series of webinars that were free, available to everyone, not just members, but non-members. We really considered at the time, should we throw the doors open? And the answer was yes, that there was such a need to help the whole profession that none of these things we charged for. You did have to register, but it was all free. So we had, I recall we did a webinar on telehealth, and it was really, telehealth 101. You're a private practice and you need to convert overnight to providing services via telehealth. How did your private practices responded? And we brought in, 4 practitioners from different parts of the country, and they talked about what they did. There was a webinar of, OTs that worked in acute care. What was the situation there? How were they dealing with COVID-19? So, that was a pivot from a very quick pivot from, face-to-face meetings to the new webinar format, all Zoom all the time, the development of more resources, and then also, advocacy initiatives, at the same time that we heard initial responses from the governors and from CMS, state legislatures continued to meet, and they started taking action on COVID-19 and related issues. The other thing I'll mention is that, we had a need to connect. And so at the AOTA level, we organized some events for members to get on Zoom, and, you recall the virtual happy hours and that kind of thing. The connections were missing. And so we focused on that. So in this segment, I would like our panelists to think back to the midpoint of well, maybe I'm not sure if we're at the midpoint yet, but back to, May, June, July, how the states adapted, how they pivoted to virtual events, virtually overnight, but also think about some of the advocacy initiatives that were launched at the time. So I'd like to go to Paula. I recall in Nevada, there was actually at the height of the pandemic, there's a proposal to cut Medicaid. So Paula, can you talk about that advocacy work?
Sure. So it was our legislator meets every other year. And so our legislator had to convene a special session. And you can imagine, last year we were all together for WROTSS in Las Vegas. That the gaming entertainment industry is the bread and butter of our state. Our economy disproportionately depends on that one industry. So when that shuts down, the state is in a budget crisis. And that was really devastating for everybody in the state, for education, healthcare, gaming, no matter what industry, you were hit by this lack of funds coming in. So our legislator convened for a special session in July and proposed what arguably was one of the worst ways to cut the budget. It was a $1.2 billion cut proposal, and they were cutting $233 million in health and human services. And part of their proposed cuts include cutting all Medicaid for adults in occupational therapy. And it really wasn't just OT, it was dental services, behavioral health, case management, optometry, you name it, it was on the chopping block. And so along with a 6% cut for other Medicaid, like pediatric services. So everybody had to kind of regroup and say, okay, this is not an option, but what do you do when the state literally has no money? So we put out calls to action, and we just flooded the state with, look, this is why you can't cut OT to adult Medicaid. We got physicians to reach out for us. Even a judge said, look, I refer adults to OT all the time. This is a horrible cut. And I was on the public comment call, and I thought I never in a million years thought I would advocate to reduce OT services for adults in Medicaid. But if you're going to do anything, if you have to do anything, reduce the services, don't eliminate them. I mean, that's horrible. So luckily that all worked. They decided our legislator did make some amendments, and they decided not to eliminate adult OT Medicaid coverage, which was great, but it also didn't feel like a total win because we were still going to see a 6% cut. So, we did what we could. We felt glad that the adults were spared, but at the end of the day, there were still going to be cuts that they were doing. Along with that, we pivoted, likewise with conferences, CEUs, but we also established a diversity committee and some micro grants to address diversity, low income, inequality. And we had, a school-based practitioner who she was awarded a micro grant, and she used that to make these fine motor kits that she delivered her students so that she could hold up an item and the students could, use the same item from their kit with her. So that's about it. Not to be redundant with other panelists, but that special session with the legislator, it was horrible. It was horrible all around, and I feel like it was a win, but it was a short-term win, and we're keeping an eye on it because we're hoping that money comes back for that 6% cut to not happen too.
Great, thanks, Paula. Brenda, before we had this session, I recall you telling me about some of the work that the Utah Association had done to support students. Can you talk about that? That sounded interesting and unique. I think it was called a hackathon. Can you tell us about that?
Yeah. When COVID hit, we needed to figure out how we were going to still be able to connect, because in our conference, well, let me just say that the Utah OT Association, we have about 250 to 300 members. So we're really a low member organization. And we're very, very, very dependent on students, because students make up at least 100 of those individuals. So it's usually around a third, sometimes more than a third of our membership are students. So we heavily rely on our 3 educational programs to promote membership. And the best way for us is to be able to connect with people face to face. So when COVID, hit, it's like, well, what are we going to do and how are we going to do this? And so we do our strategic planning in the summer, and we had to do some change up and some ideas. What were we going to do for conference? Because the conference is a moneymaker for us. And how are we going to bring these students in, and how are we going to connect? We decided to go virtual, but then Carrie from Idaho, who's on our panel, she came up with this great idea and contacted me and said, let's have a mutual conference between several states for our annual conference. And so I said, hey, that sounds like a great idea. So there were several of our states that got together to all do it. And the idea was to be able to have a lot more sessions, but the idea was also to be able to still have our individual states have our own business meetings and connect with our members and do things like that. So one of the, really important things was, what are we going to do with students? So the hackathon was, Carrie, I'm going to give that to you for your idea. I believe you're the one that came up with it. The hackathon was implemented, and what that was is an opportunity for the students in the 5 or so different states to get their heads together in an actual meeting and attack a problem that member organizations have. So we had 5 or 6 different groups of about 6 students each, and they all went into their own virtual rooms. And their question was, how do you recruit, retain student members? Because the problem oftentimes is you have the student member, but then when the student member becomes a clinician, they're no longer the student member, you lose them. And we want to be able to we want to groom our students to become members and volunteer leaders of our professional associations. So let's pose the question to the students and have them figure it out. Well, it was, it was like a miracle. They came up with so many amazing ideas of how we can recruit them, how we can engage them, how we can retain them. And so I'm writing as fast as I can as they're coming up with these ideas, because I got to be one of the judges, and it was just like so great to be able to judge it so I could hear everything, what was going on. So wrote down all these ideas, went back to my board and said, okay, this is what we need to do. So what we have done now is developed a task force in the UOTA. It's called the Student Task Force. And the chairs of the Student Task Force are the 3 educational program student reps. And we are going to promo this task force with certain jobs that they're going to do, but also give them, the students that want to be part of this, to give them the opportunity to rub shoulders with practicing OTs and OTAs, to give them an opportunity to help us on committees so that we can start grooming them to be our next generation. So we're super, super excited about this initiative, and we're rolling it out right now. We're in process of doing all the write-ups and the paperwork and adding it to our bylaws and all that kind of stuff. So we're in process of doing that. But it's because of this COVID time that this idea came forth. I don't know that we would have been able to get the same information from students had we continued on with face-to-face conferences instead of having this hackathon.
Wow, that's great. Great idea. All right, Robert, can you talk us a little bit about the New Mexico Association? I mean, you in your introduction, you gave us an overview of some of the things that happened, but how did the New Mexico Association adapt to COVID and respond to members' needs?
Oh boy, I'm listening to all these other people talk. I'm a little, I feel I'm on the spot here. You guys have some great ideas. You've done some really, have made some really, really solid efforts. I like that last idea. And then the legislation or the legislative efforts in Nevada and all that is fantastic. I am, I'm trying to, as I'm sitting here listening to everybody, I'm trying to remember what exactly it was like at the very beginning, other than just chaos and, just stunned membership and all that. But I think probably as a state association, our biggest role that we played, I mean, we adapted and we went to the online CEUs and meetings for our members and opened up. But I think that I formed an ad hoc committee early on that was really what we were faced with was just really poor communication across all agencies. I mean, I'm talking from the licensure board to the OT Association, the PT Association, the speech therapists, the university here, the students, everything. It was just, and we had a lot of questions coming in and we were trying to relay them. So we formed an ad hoc COVID committee to try to streamline, and pull information into one place for everybody from the Department of Health to the governor to, all the executive orders that she had made. And then insurance companies, Presbyterian had a big issue with telehealth early on. And so there were a lot of questions and a lot of people freaking out, as I'm sure there were nationwide, if not worldwide. But I think it helped a little bit. I did notice a lot of people calming down after we were able to pull all this information together and have it in one spot. So I think that helped quite a bit. And then just ongoing advocacy, especially in the rural areas, like I said, and getting access for these kids. It's great to have Zoom and Google Meets and Google Classrooms and all that, but if you don't have access, it doesn't do you a heck of a lot of good. So those advocacy efforts are ongoing, as are just trying to maintain. I'm just so glad we didn't get a big cut like they did in Nevada, but I think you did a fantastic job mitigating that. But we haven't been faced with that, at least over the long term. Initially, there were some issues and some hiccups with telehealth and the Medicaid waiver programs and the other insurance payers and the programs and stuff like that. So it was just kind of pulling everybody together and trying to have a unified voice, while at the same time having all the information that was easy to access and easy to get, so people weren't feeling in fringes. I have lost volume.
Thanks. Yeah, I was muted. I
Oh,
think
sorry.
that's the top quote of the year is you're on mute.
Yeah.
So thanks for that. And this next segment, we're going to talk about some of the new challenges and opportunities and how state associations will be working to advance the profession and serve their members as we come out of the pandemic. Obviously, right now, the vaccines are being administered not quite as quickly as we had hoped, but I think we are seeing the light at the end of the tunnel. And AOTA state associations are focused on advancing the profession. We have some initiatives underway now, but also looking forward to the future. So I'll talk a little bit about some of the AOTA initiatives. Obviously, we've pivoted our annual conference to AOTA Inspire. That's going to be a month-long series of events online for members and for non-members. So please check that out. In terms of advocacy, we continue to advocate with CMS on some of the usual issues around payment and Medicare, but we're also seeking to make the provisions related to telehealth permanent. In the middle of the pandemic, we were able to, number one, allow for some rules in home health to change, and that was followed by legislation that would allow OTs to open cases. So I think we have a lot of work there to do in terms of implementation and education of members. It's a great opportunity for us. In terms of at the state level, we again, at the height of the pandemic, we've launched our initiative to enact the Occupational Therapy Licensure Compact. We have legislation pending in 13 states now, including in Utah. So we're going to be looking forward to advancing that. At the AOTA level, we're also looking at governance of the association, not the most exciting topic, but we want to better serve our members, and looking at the system we have now, how can we improve it? How can we give members a better voice is important. AOTA has a DE&I ad hoc committee that's going to be coming out with some recommendations to help the profession, help the association, help all of us engage on those issues. We've been doing some market research at AOTA in terms of pricing, and we're going to be looking at some new models in terms of membership. So that's going to be exciting. I mean, it may not be, one price for all services, or maybe an opportunity to have different pricing levels. So we're looking at the state of the art there. And we're also looking at how we deliver our products and services. Our members' needs are different. And even though, things may get back to some sort of new normal after the pandemic, I think that members, consumers, and others are making a choice. Wow, it's kind of convenient to be able to participate in online meetings and conferences from the comfort of your own home. So I think that some of these changes are here to stay. The other thing I'd like to mention is that AOTA is working with the state occupational therapy associations and how AOTA and state associations work together. There's something right now called the AOTA affiliate agreement, and we're going to be looking at new ways to improve how we work together and the relationship between the two organizations. So with that, keeping the future focus in mind, but also present day, maybe we can talk a little bit about what the associations are working on right now. So I'd like to go to Bryant in California. I think OTAC has a number of things underway. Bryant, can you talk about some of your current and future activities?
Sure. I think some of them are really parallel to what you had spoken to. A lot of legislative work and eyes on what's to come within the state. A lot related to there's a few bills within California looking at telehealth and e-consults, and we're, of course, since we see the value in it, again, it was thrown into the mainstream for us, we want to ensure that it's here to stay. So we're working hard to keep an eye on those things and to advocate for those things to be in place so that we can continue to provide telehealth services and get reimbursed for that. We've had for a few years a pretty strong interest in creating leadership pathways for practitioners in school-based practice. So currently the way the language is written in the laws here in California is OTs and PTs are not credentialed. They don't have a service credential in the schools. And so they get capped out in terms of their leadership opportunities within school, in the school setting. Unlike some of our other colleagues like speech therapists and social workers and psychologists who do have that same pathway. So we're trying to create that same opportunity for OTs and PTs. So we're continuing to advocate for that. Similar to AOTA, we created an ad hoc committee on diversity, equity, and inclusion. We really want to see more work both within the association, but for the profession and our consumers related to racial justice and OT's role in promoting anti-racism and more equitable services and better representation within the profession. And then I think the other thing that we're really interested in and looking at is, what does OT look like beyond this? I think obviously some of the things in place in terms of the association work, having more virtual offerings, it does create, it makes it easy for people. But we're also hearing that people do want that in-person interaction and be able to see people face to face. But the other thing that we're talking about is, what does it look like beyond this? Where does OT go? There's been a year of occupational disruption, of social isolation, and what is the impact on people's emotional and mental well-being? There's a lot of discussion, at least here in, and I'm in Los Angeles, but in my local area related to allocation of resources at a governmental level. We've heard the term defund the police, but there's conversation here about, do we reallocate resources to more supportive services for people experiencing homelessness or domestic violence? And so I know we're consistently trying to put in the plug of, if you're going to put in resources for support services, think of OT. So I think there's huge opportunity for occupational therapy to really create a foothold in new ways of being and doing in society once we come through this pandemic. One of the other big things we're looking at the end of the year is having a symposium on OTs involved in sort of state or municipal agencies or organizations to really try to get more involvement at that systems level. So we're excited to sort of launch into that arena. So that's sort of what's to come and where our vision is. And hopefully we get to enact it and get to see people in person.
Thanks, Brian. Yeah, I'll be curious to know when we will be able to get back to in-person events. Brenda, I believe the Utah Association is doing some interesting activities to engage members online. Can you talk about that?
Sure. There's three in particular that I'd like to share. Some of these activities, organizations, other state organizations have been doing for a while. When we did our strategic planning last July, we determined that we wanted to start town halls. That had never been done in Utah before. And of course, our idea was to be able to drive to we have 6 different regions in Utah, and we have a regional rep in each of these 6 regions. And our idea was for the regional reps to be able to have 2 town halls a year. So that would be 6 town hall or 12 town halls in 12 months. But then, when COVID hit, it was like, well, this isn't going to work. So we have done these virtually, and we've just started those, and it's been really, really successful. We've been able to reach out and engage members that we probably wouldn't have known otherwise. And like you said, Chuck, it's really nice to be able to sit in your home and be part of a town hall or be part of some type of group session or learning opportunity. And so I'm finding that we might be connecting better virtually with things like town halls than we might face to face. I don't know. We'll have to see how that goes down the road. The other thing we've implemented is what we call member spotlights. And we have asked our regional reps, again, to pick one member each month, someone that lives in their region, and get their bio, get a picture from them, and then answer some questions. And we like to have fun questions. We put that on our Facebook page, and we also put it on the website. And we've had more hits than we've ever had because people are finding it fun to get to know new people that they haven't known before. So that's been new too, since we've started that. The third area that we made a change to this year, we've always had an annual Capitol Hill Day. And that's been a day when we tried to recruit people to go up to the Capitol and then engage with their representatives and their senators. Of course, that wasn't going to work this year. So we decided to have a Capitol Hill month. And so that was February. So it was this last month. We've had our Capitol Hill month, and we did a kickoff where we brought our lobbyists in, and our members were able to again go virtual online and ask questions, and we were able to have really super good communication and engage the members. And as Chuck mentioned earlier, we're in the middle of legislation right now to try to promote the OT compact licensure bill, and we've run up with a little bit of a hiccup in one of our House committees. And so last weekend we mobilized. That's what we called it. We mobilized, and it was amazing how we did this phone tree. We got out, we reached every single member that had a representative on that committee and text them, emailed them, phone contacts with them. And because of this Capitol Hill month, everybody has it in their mind that they're going to be work on legislative efforts for a whole month, which I love. And I'm hoping we can have maybe both a Capitol Hill Day and a Capitol Hill month for future. So anyway, I'm finding that some of the activities that we've been able to put in since we've had this COVID situation has been really beneficial for us in engaging members in our state.
Wow, that's great. Yeah, and in terms of licensure compact bill, let's see if we can pop that bill out of committee and through final passage. Happy to support that effort. So I wanted to go back to Paula to talk about some of the current initiatives in Nevada.
Thanks, Chuck. Well, we brought back snail mail. Everyone's got a lot going on digitally, and we thought, let's do the old-fashioned postcard initiative. And there's a lot of research to support a print mail campaign, and that was really successful for us. It's not cheap, but we mailed everybody in the state, and we revamped our website, and also updated our member levels, added retiree, undergraduate, student level member, because we get a lot of pre-OT students who reach out to us and said, hey, you know, we can have an undergraduate option too. So we've had an internship program for a while, and we've moved that virtual, which was a lot harder to orient people completely virtually who did not have prior experience with the organization. But we're going to continue with that. And we've had them work on some, for example, racism infographics, like racial disparities in stroke community, for example. Also, we started this before the pandemic, but we're trying to promote it more now, are these little video clips called Nota Nuggets. Just quick, like 2 to 4 minute videos of an evidence-based practice or a systematic review on, a quick, case study, or just something that you can watch quickly, if you want to find out more about like, fatigue in the MS population or something. So that's on our website as well. We've also been doing some setting specific outreach. So after AB3, the special session that we had in the summer, people got really fired up, right, about it. And so we started reaching out to settings, a skilled nursing facility, and we would tailor our materials to them, speak to them specifically about why membership matters. And thank you for coming out for AB3, and this is what we're going to do next. And finally, we're just looking how to increase morale overall. We're all kind of tired after this year, and so we're looking at ways to boost morale and to get the energy back again. So that's it. Thanks, Chuck.
Thanks, Paula. Evelyn, I wanted to go back to you. I recall that the Arizona Association had a town hall supporting OTs in school-based delivery. I wonder if you could tell us about that. And then also, I definitely want you to tell us about the telehealth research that was done by one of your members in Arizona. And then I think the last thing that I recall was some advocacy with this next legislative session. So I think you have some other things to mention.
Yes. So we conducted a second town hall in August for school-based therapists, because again, schools have been closed and the summer went by, and then as we neared the start of the schools again in the fall, it was clear that several school districts were not going to open. So therapists turned to us and asking, what are we going to do? How can we provide school-based telehealth services? So again, we organized another town hall, asked members to send us questions so that we could prepare it. And so we had short presentations from school-based therapists, and then most of the session was open to questions. And again, that one was also very well received. And another continuing education opportunity that came out of this was that we created a special interest section on telehealth specifically, and they have been very active and have provided continuing education almost every month on different topics in regards to telehealth. And also in the summer, we initiated a research project. It was a fairly simple survey to be sent out to therapists, just asking them to report on their initial experiences with providing telehealth, and some qualitative questions in it as well, where we asked them to reflect and compare with typical face-to-face services. And we actually sent it out to every state association. You probably recall an email from us asking you if you were willing to have this advertised on your website, and you all said yes. So, and surveys typically don't have a very high response rate, but still, it was still valuable, we think. And the two researchers who analyzed this, they were actually able to publish this in December already in an online journal, International Journal of Telerehabilitation, about their experiences from therapists providing telehealth. And overall, it was very positive. Most of the respondents really felt that they could provide quality, efficient services this way. And of course, lots of limitations. Maybe the ones who responded were really happy with the service model and so on, but still, it's a beginning. So we tried to start to create a beginning evidence base there for telehealth services. And of course, the most important thing for us is to make sure that that telehealth provision becomes permanent in Arizona, because we see this as a valued provision, and we have many rural areas, and now we've seen that it can really be a quality service. So we had to start the bill again, and because our legislator, of course, closed early last year. So, and this year they are backed up, but the bill is moving forward. So it's actually now in the Senate committees. So we are hoping it looks like it's going to be approved before this legislative session closes. So that is really good news. And actually, as this Thursday evening, we had a very good session led by our telehealth special interest section, where we invited Senator Barto, who has been one of our stronger supporters of this bill, and she was able to give us some insight as to where the bill is and how she saw it moving forward, and it was very positive. So, and we also got some advice on how we could continue to be active in informing our legislators on the importance of this bill, and also occupational therapy services in general. So,
Evelyn, thanks for that overview. Just a quick question. I mean, the legislation, was it specific to OT, or does it impact other providers in telehealth?
It's not specific to OT, no.
Okay.
As far as I understand it, yes.
Others. Okay. All right.
Yeah.
That's good to know. All right. Well, I wondered if Carrie, you could talk about some of the initiatives with the Idaho Occupational Therapy Association that are underway now, or that you're planning for the future.
Yes. Yeah, so again, like everyone else has mentioned, so many challenges this past year, but honestly, I think, again, as OTs, we always look at that glass half full and again, look at them as opportunities. And for us, I feel like a lot of opportunities have come about that we never would have had ever even thought about before, really. Or we thought about them, but we just never put them into action because other things always came up and you ran out of time. But this just pushed us into it again, kind of going with that virtual conference. We are going to look at doing something similar again this year, whether it's full virtual conference or a hybrid version of some sort, but I don't think we'll be meeting full annual conference in person again this year. With that, we've also, last year, we decided to record almost every single session that we had. We offered around probably close to 20 hours of our own continuing ed kind of throughout the year with different sessions, and just being able to put those into courses and create a course library on our website. That is not something we've had in the past, but that's something that we're, in the process of doing now. Our annual conference, the platform we chose was open for 6 months. So our members still have the opportunity to be watching through June. So we're in the process now of making those sessions actually on the website so people can purchase those throughout the year. And again, just continue their profession, continue their knowledge throughout the year. So that was one of the things that we did that I felt was really positive that came out of this. The other thing that we're really looking at, as Bryant mentioned, everybody's occupations right now have this past year have just been in a complete disruption. And with everybody being socially isolated, we're finding that everybody's mental health has been challenged in one way or another. And OTs aren't necessarily recognized as mental health practitioners, definitely not in our state. A little bit here and there, but not as much as we should be. And we do know that some states have gotten that passed. So that is what we're really going to be working on this year, is getting OTs recognized truly as mental health practitioners within our state. And we're reaching out to some of those other states that we know have gotten themselves kind of more recognized, and that's where we're heading this year. And we just feel it would be really valued, and it's needed because we are the ones that people should be going to, and we think we can just really contribute a lot to overall the well-being of everybody. So
Wow, that's great. All right, I wanted to go back to Robert to learn more about some of the current and future initiatives of the New Mexico Occupational Therapy Association. What's on deck next, Robert?
Well, we just had our I failed to mention this earlier. We just had our legislative day, which was put together by our legislative committee. Did a fantastic job. Mari, Jason, and Ellen all did a great job. They bring a lot of the University of New Mexico students in, and a lot of our membership in, and really educate and support advocacy efforts for whatever legislation that we have going on. This year it's pretty light load, but supporting things like well, first of all, the Physical Therapy Association working on their interstate compact, excuse me, and so we're just supporting them and hope that they support us when we go through ours in a few years. So aside from that, just helping advocate for funding for early detection of cerebral palsy with early child care health workers. If I can speak, geez, some different fundings for TBI resources, collecting data, making sure the continuity of care is up and good. So we're just continuing with our legislative efforts. As far as everything else goes, we're still the source of information. At least we like to think of we're the single source of information for all those things that are still going on. I'm listening to all you guys and just writing a lot of notes. I'm stealing your ideas because I like some of the things that I'm hearing, and I think that we're going to have a lot of efforts based on this meeting today going forward. But just maintaining our position. We're really trying to get our membership up. I think I mentioned last time we met, our membership took a significant drop, about a 50% drop, because our conference was canceled, and most people renew their memberships then. So I like the snail mail idea, Nevada. Thank you for that. I think we're going to give that a shot. And you're right, it is expensive, but I think it's going to be worth it, because we get inundated with these emails and all this digital stuff, and I know that I'm guilty of it. I'll swipe and just delete. So I want to do that. Just try to get our membership up and strong again. We have a strong executive board and general board with all of our committees. They do a fantastic job. I've never seen a board work so hard and do as many things as they do, and do them successfully. But we're looking for, unfortunately, a virtual conference, or well, fortunately or unfortunately, I prefer to be there in person, and shake hands and all that good stuff that we used to do. But we're going to do it virtually, and I have a committee of seasoned experts, a couple of ex-presidents on this committee. I'm so lucky to have them, who are gonna run the show this year. And so I think it's going to be a huge success. Our challenges, and I would love to hear anybody else's ideas, kind of a fundraising thing. We used to do an auction and all that kind of stuff. So if anybody's got any great ideas for that we can do virtually, I'd love to hear them. But we're just business as usual. We're trying to advocate, and we're trying to keep people informed, and we're trying to be that place that people can go, and we're continuing our legislative efforts and advocacy and all that we can do. And just trying to keep, I hate to use the word fighting, but fighting for more resources, for more money, for more access for the people that we serve.
Great. Thanks, Robert.
Mm-hmm.
And thanks to our panelists today for this very interesting session. We're going to have a quick round of closing comments. I'll go first. And thanks to all of you for participating in the Spring Symposium. Thanks for your membership in your state occupational therapy association and for your membership in AOTA. It's your membership that has provided the resources to the associations to develop the resources to advocate for you. So with that, I'd like to go to Evelyn to give us some parting thoughts.
Thank you for the invitation to participate in this panel. I too have learned a lot. And I also want to say a thank you to AOTA, which I didn't before, for all the support that we had during this year. You also helped us with the construction of the survey, not the least, which was very important, but everything, all the continuing education that's been available to us, it's been great. And thank you, WROTSS, for being able to have this conference this year in this format. It's absolutely fabulous. So thank you so much.
Thanks, Evelyn. Carrie.
Yes, I couldn't agree more. I don't mean to repeat exactly what Evelyn's just said, but Chuck, I think AOTA has been such a blessing this year. I don't know what we would have done without all of your guys' resources and putting together the quick town halls. And that was just really beneficial. I also feel that so many of the states and the state presidents put together just different things, and they were great resources for us. And we were constantly having virtual sessions with all the different states on anything and everything, and everybody I felt just came together. And I just think it was so beneficial. And I think when everybody pulls together and works together, great things can happen. And I think this is, again, just another success story. When you look at it in the big picture, there's been a lot of successes. And with the WROTSS, again, I think it's awesome. The fact that they can still figure out a way to have us all together, get the knowledge out to all of our members, and have everybody work together again.
Great.
So thank you.
Thanks, Carrie. Thanks for those kind words. And the state associations are AOTA's most important strategic partners. Robert, to you, some closing thoughts.
Chuck, I just want to say thank you to you personally. I mean, you've been there, and you've never hesitated to answer any questions or provide any kind of advice or, to advocate. I think you've done a fantastic job. Since joining the thing last year, the WROTSS, it's so awkward for me to say, I'm dry mouth. I've really discovered oh my goodness, Carrie just said, I believe it's Carrie, right? There's just when people come together, and I'm really starting to realize that, we feel kind of isolated down here in New Mexico. We're a small state. We don't have that many people. Our association is kind of small, but one thing I've learned this year is just this virtual thing is nuts, because like I said, I'm an in-person kind of guy, and I'm finding out that this virtual thing is really bringing people together in a way that I never imagined. And to sit here and listen to you guys and look at you and learn so much from you is fantastic. So, you know, those are my my closing comments, is just thank you to Chuck for running this show, and then everybody else for coming on board and giving me some great ideas and making me feel like we're actually doing it okay here too. So I appreciate that.
Great. Thanks, Robert. It's been a privilege to work with you and the other state presidents. Paula.
I want to repeat, you all are doing a great job. I hope you feel like you are. I'm listening to you all. You guys are doing a great job. You're killing it. I know it feels like we're not sometimes, but we're doing what we can, the best we can. And so thank you all for serving your states. And thanks to the state affairs team at AOTA. We learned so much from you guys. I know you get our emails like, why is our regulatory board doing this? Can you help us, please? Thank you for helping us. And then the next time around it happens again. So I just wanted to say that, you know, Carrie, let's talk about QMHP, because we're working on the same goal in our state. And then when other, you know, firestorms come up, we put out those fires, and that QMHP gets kind of put on the back burner. And I want to stop doing that. So let's talk and get it going for both of our states. And just thank you all for this format. I would love to chat with you all again sometimes. And that's it. Thank you all.
Great. Brian.
Yeah, like everybody said, huge shout out to AOTA for being a great partner and ally through not only this year, but all the years. And the other thing I want to just say is a huge thank you to our members. I think for all of our states, it's through membership that we're able to even function. And so thank you all for attending this conference, for being members and being actively engaged in your state associations and national associations. And I continue to encourage you to do so. Maintain your membership, bring a buddy along. Volunteer, get involved with your state association. It's a huge resource. It's a huge networking opportunity, and it's a great way to build these partnerships. And I think we've heard from everybody here just the power of the association. So that's my plug, and thank you all for maintaining your membership.
Great, thanks. And Brenda.
I just want to close by saying we're all OT practitioners, so we know how to adapt. That's who we are. We teach others to be resilient, so we must model that too. And I'm really proud of the small but amazing group of volunteer leaders in Utah and in other states who have weathered this year, continue to be energetic, continue to be engaged. And I also want to thank our members and thank all of you for listening to this webinar panel and listening to our stories.
Great. Thanks to our panelists. Now we will move into real-time Q&A. Please enter your questions in the Q&A panel.
This is the end of the recorded portion of the presentation, and now we'll move to the live Q&A with presenters. If you have a question, please use the Q&A feature at the bottom of your screen, and if time allows, you will have the presenters address it. And so the question we first have is, with communication and other challenges in mind, how many of you have a standing member position for your association on your state licensure board? If not, do you think this may make a positive impact if you did?
I can respond to that one. It's a conflict of interest to be able to have a licensure board member on a state board, because the licensure board itself represents the clientele of who we practice with our clients and the protection of those clients. The member organizations are in place to represent the members. So you can't be a person who's representing an OT practitioner and a client at the same time. So that would be a conflict of interest to be able to have someone who's on your state board to also be on your executive board for the association. However, there can be communication and there should be. And anytime, at least in Utah, whenever we have an open position on our state board, the governor, the first group that the governor looks out to is the Utah OT Association, and sends us an email and says, hey, or a letter, and says, do you have any recommendations. And so then we go to our membership, we see who might be interested or might be good representatives for the profession and make those recommendations to the governor. So that's really how that interaction needs to take place.
And the next question is, are there any changes coming related to modality approval for OTs in California?
I'm assuming you all want me to answer that, right? So thanks for the question. You know, a couple years ago when we did refresh our Practice Act, there was language in there related to the ongoing requirements for advanced practice. So I know that CBOT, the California Board of OT, is working on now creating the actual operations to match the language there. Ultimately, it is up to them to sort of interpret the language there, but we did successfully get that changed a little bit to reflect that it didn't necessarily have to all be post-professional education and training, knowing that ACOTA standards had changed, and just sort of the level of our overall education had changed in the 3 areas of advanced practice. So hopefully that answers your question. I don't know if there was anything more specific, but we can always touch base offline. You can reach out to our Practice Ethics and Reimbursement Committee for questions, and hopefully we can partner better with you to help you navigate that.
Right, thank you. And due to constraint of time, we are down to our last question. It says, I do have a concern that the fear of change or loss of scope of practice within states with strong competing professional disciplines has been almost constipating and limiting. Having worked in 6 different states in so many different regions in the US, I do wish there was a way to help with bravery, as all of you have demonstrated. But I wonder if states have the tendency to have recycling of leadership might not be as informed or open to this current dissonance and occupational disruption as an opportunity. Did any of you feel vulnerable or apprehensive about being part of reaching across to communities, states that have different priorities or membership dynamics? Can the panelists give advice to what made you seek state line or associations as colleagues?
I'll try to answer sort of the first part of that, and what members may not appreciate. And actually, there was some chat in the chat box about ASAP. ASAP is the Affiliated State Association president. So there are 52 AOTA state affiliates, state occupational therapy associations. The collection of all of those state presidents is the Affiliated State Association president. So they meet once a year. Used to be face-to-face. Now everything's gone virtual. And it's a network of fellow state association presidents, and they communicate. They exchange information about best practices. And actually, a small subgroup was created to discuss the move from face-to-face meetings to virtual meetings, and ideas were shared in real time. So that is happening now, and I think we more. I think you saw some of that in this webinar, that states are moving forward with ideas, and I think sharing those is a fine idea. So with that, I'll just defer to the panelists to talk about some things maybe that they've been thinking about.
I mean, I think one thing that struck me with the question there is the profession is we're sort of predicated on being lifelong learners, right? And I think many of us as in association work, we look at our membership relative to the licensed professionals in our area, and there's a big gap there. And so I think it's sort of incumbent upon us to sort of challenge ourselves and ask, why is there a gap? And I know that feedback that we've heard here is, hey, maybe we're not representing the interests of those people that aren't members. So it's about being open to that information, that learning, that education. We're never going to know everything, and so if we don't diversify our modes of communication, the representation, the perspectives, we're going to be missing out. And I think the richness of the profession is really based on all of those things, on the diversity of things. So it's uncomfortable, but it sort of needs to be in order to change, right?
And as far as feeling vulnerable, oh, sorry, Brenda.
No, Paula, go ahead.
Oh, thanks. I'll be quick. As far as feeling vulnerable, no, I would agree. We're lifelong learners, and I I always look to other states for examples, you know, QMP, I'm looking at New Jersey, they just passed it, right? I read about what other states are doing in OT practice and think we can do that here. So I enjoy speaking to other states and learning from them. I think that's how we grow.
There was a component to that question that talked about the strong competition with other disciplines and the opportunity versus the threat to that. And I'd like to just speak really quickly about that. Since we're all volunteer organizations, we're so dependent on the number of members that we have in these organizations for strength. And for strength, that would mean financial strength to be able to battle issues that would come up, or to even be able to receive assistance, support staff to be able to help us, because we're all working full-time jobs and we're having to volunteer. So when these issues come up with other disciplines, it can be looked at as an opportunity, but it can be looked at as a threat too. And oftentimes it is a threat just because the amount of energy that we have at the end of the day, or the amount of financial resource that we have at the end of the fiscal year, may not be able to allow us to be able to jump on issues as quickly as we would like to. And I really appreciate that the AOTA is looking at a possible affiliate type of position with the state associations, because in my mind, I really think we need to join forces very strongly so that we're stronger together than we are separate.
Okay, thank you, Brenda. And this concludes our session. Thank you, presenters and attendees. Attendees, don't forget to copy the link posted in the chat. And thank you again. Have a good rest of the day.